I call this meeting of the Northeast Independent School District to order. Let the record show that a quorum of board members is present, that this meeting has been duly called, and that notice of this meeting has been posted in accordance with the Texas Open Meetings Act, Texas Government Code, Chapter 551, and the time is 5:30 p.m. The board will now adjourn into executive session pursuant to the following sections of the Texas Open Meetings Act. Texas Government Code Section 551.071, private consultation with the board's attorney. 551.074, to discuss personnel or to hear complaints against personnel, and the time is 5:31 p.m. The board will now convene in open session, and the time is 6:29 p.m. Thank you all for your patience. Item 4, matters from executive session. A, personnel, including but not limited to administrative appointments. Pursuant to Government Code Section 551.074, 1, possible action regarding routine personnel, including but not limited to administrative appointments. A, principal of Johnson High School. Do I have a motion to approve as discussed in executive session?
So moved.
Thank you, Ms. Landry. Do I have a second?
Second.
Thank you, Ms. Cox. All those in favor say aye.
Aye.
Those opposed say nay. Motion passes 7 to 0. Sorry, 7 to 0. Item 5, presentation. A, budget study session number 2. Mr.
Yes,
Villarreal.
Mr. President, members of the board, Dr. Mike, executive staff. I call on Susie Lackhorn, our Executive Director of Finance and Accounting, to present.
Good evening. Welcome to budget study session.
Can you hear me now?
Yes.
Good evening. I'll try that again. Let's get started by looking at our schedule. We completed our first budget study session on the 19th. Tonight, we've got a change in our plan for the topics thanks to our legislative session. But we're going to talk a little bit about staffing, our additional allocation request, health insurance, and we're going to give a legislative update. Because of the timing of the school funding bill and all the requirements that come with it, we will save our big compensation discussion for next week at the regular board meeting. So we're going to call that budget study session 2A. And then we'll have number 3 on the 16th, and we'll do our final updates and our detailed budget view, and then adopt on June 19th. So just to get it out of the way, the big school funding bill, we've got language yesterday afternoon. So I'm about 90 pages left to go of a 231-page bill to make sure that it matches what our expectations were. So we got to read lots of pieces throughout the session, but now it's time to make sure that nothing changed while they were marking it all up. All right, so let's get started. Our staffing, this is the agenda. We'll talk health insurance and our AARs, the additional allocation requests, and we'll do our legislative update. Reminders from budget study session number 1. When property values change, that doesn't mean that we get increased or decreased revenue. The state just offsets for whenever it goes up or down. If it goes up by too much, we have to lower our tax rate, and this still applies a little bit. Even though we're at the last day of the session, we still have unanswered questions regarding what all the legislation does. All right, so let's get started on staffing. Over the last several years, we've made a concerted effort looking at central office, and these break down by year the savings we've had by either changing positions or eliminating positions. Last year when we presented 24-25, we actually showed a much smaller number here. So this is actually after we finished updating everything. So even in August, we were still making plans. And so last year we eliminated 24 positions and it saved about 1.6 million. For 25-26, we're still reviewing and we'll continue to do so. But we've already identified 5 positions and then adjustments to other positions and restructuring. So 462,000 in savings is not just 5 individual positions. Some other positions have changed. We've really allocated things. And so that's all the central office changes that we've identified at the time we built these slides. So it's about $4 million in savings for the general fund over the last several years and 5.8 million through all of our other funds in total. For campus staffing for 25-26, we're looking at a teacher reduction of 110 teachers. That'll save about 7.9 million and 14 non-teaching professionals and 27 campus assistants, saving us about 10.2 million. We'll also maintain our contingency in Dr. Micah's budget so that, everything we project is based off of projected enrollment. And so if projected enrollment comes in higher and we need to add teachers because we're exceeding staffing thresholds, and then we'll use that contingency to fund hiring teachers as we need to in the fall. It's a good problem to have too many students.
Hey, Susie, before you move on, what is the percent of those central office and campus staffing that are due to attrition, retirements, or just positions that we're just not going to fill anymore because they've been either consolidated or we just don't need it anymore?
Everything will be attrition. So we have to hire between 400 and 500 teachers every year. And so this 110 positions will be absorbed as we have to fill those in turnover.
Okay, I just want to make sure we clarify
Yep.
that for everybody.
It's excellent.
Thanks.
Points made.
So, can I ask about those teachers? Is it mainly because of reduction of students, or are we raising class sizes, or how are we getting all those numbers?
Some of it is the consolidation. Some of it is
Sure.
our projected enrollment loss. And that's pretty much it. We didn't make any major changes to the formulas.
Class size, okay.
We are in year 2 of our secondary staffing redesign. And so we did redesign that formula. So part of it is also due to that. And so it's slightly a change in formula for secondary. Elementary stays the same, consolidations and loss of enrollment. So let's talk about our self-funded health plan, a key part of our overall compensation. Our health plan enrollment history over the last several years, you can see as we are shrinking in enrollment, we're shrinking in staff, so we do have fewer participants in the health plan. The percentage is decreasing too, but overall, we're at 71.2% of our staff enroll in one of our options. We have a low option, which is an 80-20 PPO, a high option, which is 90-10, and a high deductible health plan. And so between those plans, we've got 71% of our employees enrolled. The rest of our employees qualify for a hospital indemnity, and you can see here how we've changed from one year to the next. When we look at our medical and prescription costs, we've seen an increase over the last year. This is calendar year of about 3.6 million, which is actually less than what was originally projected. So this is actually performing better than expected. Our overall
Can I ask-
medical,
I'm sorry, can I ask a quick question?
sure.
If our employees switch from the enrollment to just the hospital indemnity, when they get that letter for their tax purposes to show that they were enrolled in a plan, do they still get that letter that shows that?
Oh, that's a good question. I might have staff in the audience that could help me out with that. They should get a letter.
Okay, so they're considered covered even with just that bare minimum?
They have been given the opportunity to have the insurance, so I think so.
Right, but the letter says you were enrolled or you weren't enrolled. And if they have the hospital indemnity, are they covered for tax purposes?
The 1095, that's what you're talking about, yeah. We will research that, make sure we're giving you the right answer, because I'm afraid my 1095 rules are not at the forefront of my brain, or maybe anywhere in that brain, and so
I got it. And
we'll
the reason that I'm
research it.
asking is because there's an increase in that option, which, and I know we've heard from several individuals that they had to drop their insurance because they just couldn't afford it anymore. So I wanted to see if that also impacts them negatively.
We'll get that answer for you.
Okay, thank you.
All right, so overall, our medical and prescription increased in plan year 2024. The bulk of this was driven by prescription. And you can see here a couple of the drugs that really had increased costs. For next year, Blue Cross Blue Shield is projecting a 7.9% increase in medical and 11.4% increase in prescription for our 2026 pricing. Healthcare costs per employee, you can see a pretty steady rise here. Our forecast for 24-25 is higher than 23-24. It's no surprise to anybody out there paying for prescription drugs or going to the doctor that these costs are increasing. So where does that money go? Well, the bulk of our spending on our self-funded plan goes to prescriptions, 32%. 30% is for professional services, so when you go to see the doctor, and then 16's at our inpatient and 15% at outpatient, so a pretty similar breakdown there. And then 3% is just administrative costs, and 3% is reinsurance. That's where we're buying insurance for those really high, expensive claims. Here's our premium history. And so, as you can see, since 2019, our employees have had 2 increases. The district has chipped in additional funds 4 times throughout those years. As time has passed, back in 14-15, the district was contributing about 64% of the total cost, and employees were contributing 36%. And as we have continued to make investments, you can see that we've grown to 74% versus 26%. This is what we're proposing for next year, is actually to leave all the pricing as it is. When we look at how the fund is doing this year, it's doing, we're coming in better than projected, like I told you. And so the fund is looking decent to end the year. And actually, let me get to that slide. So we're projecting not quite a break even, a loss of 1.78 for fiscal year 25-26, and a loss of, for the plan year, at 5.75. But again, we're really using a lot of pretty far out projections for that plan year 2026, and we'll also have a chance in July of 2026 to make any adjustments that we need to on the district's contribution. When you look at what we look like on the fiscal year summary and include our fund balance, we've got a nice healthy fund balance in the health insurance fund. We're projecting 2025 to end with an increase to fund balance at and be 3.8 months. And then our budget for 2026 would be a small loss, $1.8 million out of the $85 million worth of cost, and still above 3 months of fund balance.
Yeah, and Ms. Lackhorn,
Yes, sir.
let's just clarify. Fund balance for medical, not our fund
Correct.
balance.
This is not our
Okay.
general fund. This is for the health insurance fund. Every year, we go through, yes, ma'am.
Is the fund balance requirement the same for the health as it is for the main budget?
There is no requirement for the health fund, but it is nice to see that there are reserves there in case, we have years where the projection is short and costs go up considerably more, and we have what happened this year where we were projecting a bigger increase and it ended up not being as high, and so it kind of swings pretty heavily. And so having reserves helps us ride those years where the increases are more dramatic than what we were projecting and being able to plan for.
And one more question. If the promised cuts in prescription costs come to realization, is that a savings for the employee or for the district?
Both.
Both? Okay, cool. Thank you.
Okay, so every year, we ask our departments and our campuses to request any needs that they have for the next year, program changes, things like that. For the first time ever, after 20 years, it's zero. We had a handful of requests, the smallest number I've ever seen, and at this point in time, we don't intend to add any costs for any program changes. And
But what are we gonna do with the request? They were so insignificant, they didn't warrant.
yeah, there's actually one that would be too small to make it onto the slide.
Okay.
So,
No, but Ms. Shelton, again, we're still running a deficit. Okay? And that's the bottom line. We are, you know, with the passage of HB2, and there's some good stuff that comes in out of it, we are still gonna run.
speaking of HB2. All right, so today's an important day. It's the last day of the session. I figured something would happen while we were talking, but I don't know that anything's happening right now. June 22nd is the last day for the governor to veto or sign bills.
Cool down.
Did anything happen?
Not education related. There was a lot of judicial pay conversations today.
All right. Okay, so same as last time, bills signed by the governor, the educational savings account bill, Senate Bill 2, Senate Bill 569, which does virtual education. These have passed by both chambers. Some of them have already been sent to the governor. Some of them will be on their way. 1023, we talked about these last time. It just adds links in our truth and taxation forms. We have to put a tax increase language on voter approval for a tax rate election. There's going to be a database of debt. And then HB 210 prevents vendors from bidding on school district contracts if they have a relationship with someone on the board of trustees. Then big news over at the end of the week last week, House Bill 2, the school funding bill, has passed both chambers and is on its way to the governor. Senate Bill 4 increases the homestead property tax exemption from $100,000 to $140,000. That will require a resolution approval in November by voters. These have never not passed. We've done them several times as a state. Senate Bill 23 increases the homestead exemption for elderly and disabled. The lieutenant governor has actually talked a lot about this and how much it saves our over 65 population. Senate Bill 1453 will just change some budget publishing and debt requirements. 1173 increases the purchasing threshold to 100,000. So in September, you'll, instead of having the over 50,000 report, you'll have the over 100,000 report. HB 9 increases business personal property exemption to 125,000. They are, unlike SB 4 and SB 23, they are not providing a hold harmless for this, but its impact is significantly less. So it will not drive as much lost property tax revenue to us as increasing the homestead exemption on from 100 to 140 is significant. We still had SB 506. At this point in time, I haven't checked in a few hours to see where it's at. So we
I'd
think
have to go back and
we think this one's gone through, but it's just really just requiring that election ballot language be neutral. Kind of, I think sometimes they just put things in law that were already happening, and it's just clarifying it basically. Okay, so House Bill 2 looks very different, but with a lot of similar pieces since we met 2 weeks ago. So we're gonna go walk through what changed and what stayed the same. The basic allotment increase of $55, which they funded by changing the golden penny yield, still there. And so the classroom teacher allotment, teacher retention allotment, they actually changed these rates in order to fund some new things. And so previously, if the enrollment was 5,000 or less, so our smaller districts, it was 5,000 for 3 to 4 years experience and 10,000 for 5 or more. In order to be able to fund other things, they lowered those rates to 4,000 and 8,000. On enrollment of 5,000 or 1 or more, the 2,500 is the same, but the 5,000 was 5,500 in the previous version of the bill. So that changed from 5,500 to 5,000. A thing to note here, and I highlighted classroom teachers. There are other staff who are funded or paid using teacher pay scales throughout the state. So this is pretty common throughout the state that lots of staff are on the teacher pay scale. Classroom teacher is in the bill language, and it actually has a definition in code. And so it requires a teacher to teach for more than 4 hours, not 4 classes, but 4 hours a day. And so it's just important to recognize that this is specific to a more specific subset of people who are on the teacher pay scale. One of the new allotments is to create raises for non-administrative staff. So it allows you to use those funds to pay for raises for teachers who are not 3 years of experience or more, and any staff who are not considered administrators. Administrators are considered to be the superintendent, the chiefs, principals, assistant principals, and anyone from central office who's in a supervisory role. It also creates a new allotment to help offset costs. Fixed costs is basically what they were doing. So this is a recognition of the inflation that school districts have been dealing with for a while. So they said allowable costs are transportation, utilities, insurance, and payroll taxes, basically. And so very new change. This allotment is actually funded off of enrollment instead of average daily attendance. So it's one of the first times we've actually seen them using enrollment. Very different change. Previously, they were doing a new funding model for special education based off of intensity for service. That's still in there. The $1,000 of reimbursement for every special education evaluation, that is in there too. We had talked previously about them doing extra reimbursement for 2 years for private school students. This does not read that we would get that extra, but reading the language, it looks like we get it for every special education evaluation, the $1,000. It is not specific to just our students. So it looks like, again, I still have 90 pages to go, but I've read that section again, and it looks like it qualifies for any evaluation we do. Adding JRTC courses to our career and tech. They are capping that, but the cap looks like it's about what the total spend would be. So more career and tech funding for that.
Yeah, we have a question over here.
Oh, I'm sorry.
I'm sorry.
It's okay.
So the $1,000 is for Northeast students and private school students?
It just says $1,000 for every evaluation completed. So every initial evaluation completed.
Every
So-
initial evaluation.
So if you're-
in their 3 years, when they need a new ARD or they need a new IAP or whatever, they don't get that $1,000 for that.
It would just be the first time you evaluate that student.
And so for private school students, when new testing is due, we don't get money for that. And do we still have to do that testing?
We are required to do evaluations when requested.
Okay.
But
So-
again, we are still in the very early stages of evaluating this. The other thing we have to bear in mind is when we read these bills, we can read it a certain way, and then the commissioner can actually implement rules a lot of times and changes. And we've seen situations where we really thought it was gonna do this, and then the commissioner implemented it this way. Or,
What your understanding right now is that for a kindergartner in a private school, we get $1,000 for that. When that child needs retested in second or third grade, we test that student and we get no funding for that. Thank you.
But we've always had to do that. Isn't that correct, Mr. Jarrett? I mean, we've always had to test.
So I'm not sure on the private school. Vanessa, can you answer that question?
Evening. Yes, we have to test students when parents request. If they're within our boundaries, that's a part of our obligation. So yes, we have to.
okay. Anything else on evaluations? The P-TECH multiplier is going from $50 to $100. That's still expected to be in there. Our early education allotment formula is changing. They're going to estimate how much they think the full day pre-K added costs to each district, give you that, and then take the leftover and allocate it to everyone. They created another little piece. It's very complex. That's why this statement is saying it just adds complexity. In the long run, we expect additional funding for this to help pay for reading and math academies that they're requiring and some of the tutoring stuff that they're requiring through this bill. Given that we are pretty active in pre-K already, it looks like the funding formula should balance out for us. Creating allotment for some of the reading intervention that'll be required. They're increasing the CCMR, College Career Military Readiness Outcomes Bonus for special education students. It's doubled from $2,000 to $4,000. It's increasing the teacher incentive allotment and adding another level. So all the rates for teacher incentive allotment is going to go up, and they're going to bring in another level. So allowing more teachers to qualify for it. They're increasing the school safety allotment. They actually it's going from $10 per ADA to $20 per ADA, and $15,000 per campus to $33,540 per campus. And they passed a bill this weekend, Senate Bill 260, that does the exact same thing, and it's also in HB2. So if you hear about the school safety bill increasing the funding, that funding, it's an exact match to House Bill 2. So I guess if you pass it twice, it means you really wanted to do it.
That doesn't mean we get double.
No, you don't get double. The rates are still the same. But don't let any news reports about that SB 260 throw you off. It's still whatever's in House Bill 2. They match. Mileage reimbursement for special education increases by 5 cents, and now we can get reimbursed for 2 certification exams for those industry-based certifications. We've got a lot of students who actually do quite a few, and so it's nice to see them recognizing that effort and that.
Is there a cap on the amount for those 2 certifications per student, meaning the reimbursement? So
There may be a cap for the overall program, but not, I
not
didn't
like,
see
hey,
a restriction.
we're all going to reimburse you $50 a test or anything of that.
I do not remember seeing that, but again, I still got a few more
Still got
pages to
90
read.
pages to go.
Do those certifications count towards our CCMR outcome?
Oh, CCMR outcome is kind of convoluted in a lot of ways. And so, do I have my CCMR person here today? Esmeralda, can you help me out? I don't want to misspeak here.
So we have a list of TEA recognized industry-based certifications that count towards CCMR, that yield our CCMR bonus outcome. But the additional funding is coming for these additional dollars for the reimbursement for additional certifications. So even though we can outfit more students with more certifications through CCMR bonus, we still get that additional certification reimbursement for a kiddo who maybe is not successful the first time, takes it the second time, and then they pass it. We get reimbursed for both.
So it shouldn't change the CCMR outcomes bonus output. because it's only changing the reimbursement one, but those tests are included in that calculation. If that makes sense.
And when the student passes, then they yield the CCMR outcome bonus and it closes the loop on the expenditures.
Okay, that's exactly what I was wondering.
Okay.
Thank you.
Thank you. I never would have said it that well.
I'm sorry, Susie, just back to TIAs. Is the increase for new TIAs allotments, or does that
So
go backward?
there are 3 existing levels: master, exemplary, and recognized. And they all have ranges of rates. So they're going to increase all those rates. And so those recognitions will be worth more. And then they're going to add another layer called acknowledged. I think it's acknowledged. It's something like that. And so there's going to be a 4th layer, which means there's just another opportunity for more teachers to get one of the levels.
Is
But-
acknowledged above masters, or?
It's at the bottom.
It's at the bottom. Okay,
Yeah,
that
it'll
makes
be
sense.
acknowledged, recognized, exemplary, masters. And then those 3 are going to slide up in value, and then the new ones being added at the bottom. Okay. All right, and so they're making some changes to additional days school year. We talked about all of these last time. Children of classroom teachers can be eligible for pre-K funding, just like some of the existing requirements.
Do we know how many teachers we have that would utilize that?
We don't know how many would utilize that. We know how many are currently taking advantage of our tuition-based pre-K, and that number is 49. Right around 50. It prohibits districts from charging tuition for pre-K students if we really don't understand how this is going to work yet. And so TEA is going to be heavily involved here in determining whether or not a private provider is there. This is part of the bill that I haven't reread yet because it's going to require quite a bit of, I haven't gotten to it, and it's going to require quite a bit of thinking to see how they lay this out. And it's one of those things that we're going to have to wait to see till TEA pushes out rules.
Mr. Bywaters, I know you and I talked about this pretty extensively and weighed in. Have you read this section and what has it changed any since you and I discussed it?
My understanding, and I have not read the new portion of it, but listening to one of the senators, my understanding is this is not a piece of the bill that is implemented in this upcoming school year. I think they're still trying to hammer out some of the how it's going to work with TEA and how they'll appoint those 4 pre-K providers, or I don't remember the exact term, but in each area.
Yeah, they need time to set it up and build rules. So we'll have to wait and see what that impact looks like once they get going on it.
And I've heard a timeline of 2 years is what has been said on the House or the Senate floor.
Can I ask, what's a non-eligible? Just meaning the kid doesn't live in the district?
So for pre-K, to be funded through pre-K, you have to be economically disadvantaged or special education. Military. I mean, there's just a handful of requirements. So not every child at age 4 qualifies for state-funded pre-K.
And it says children of classroom teachers. Is that designation that specific?
Anytime you see classroom teachers, it's going to be that same definition of teachers who teach more than 4 hours each day.
Got it. Thank you.
So Miss Landry, and that's just a reminder, like that's in law, that definition. So when they use classroom teachers, that is going back to their definition, so it excludes some folks from it.
So an assistant or a librarian or a nurse's child may not attend.
And attending could be possible.
If they
but-
don't qualify.
But their ADA won't count towards funding. So basically, right now, those students who pay tuition for our pre-K program, they don't count in the funding formula from the state. And so their ADA is not included in our funding formulas at all. And so that's what the differential is. So eligible students, their
Who are
ADA.
nurses' children can attend, but we can't charge tuition anymore.
It's gonna take a little while for that to work its way as we wait for the commissioner to write the rules and those kinds of things. So we might have a few years before all of this is put into place. Our golden penny yield, which used to grow each year, will be frozen as they're using that funding to pay for the increase to the basic allotment. That's staying the same. They're requiring math achievement academies and literacy academies, which they kind of already had. They are waiving certification fees for the first time they take a test when a teacher wants to taking the special education and bilingual certification exams. This bill is 231 pages. It's not just school funding. The school funding piece actually would be pretty small. There is a massive amount of stuff on teacher prep programs. I really struggled to get through that section today because it was just one kind of program after another and all the things involved with those teacher prep programs. Lots of information on just a wide range of topics related to education. So it's touching the education code. But again, just a whole lot in the bill. It does a lot. And it feels like every time you turn a corner, there's more reporting required and pretty, all straightforward stuff, but still a lot to unpack here. We're still working with our school finance experts across the state and getting their interpretation and everything. And so a lot to digest. So also in here.
Susie?
Yes, sir.
Jim, I'm just going to ask Mr. Bywater something. When House Bill 2 started out, correct me if I'm wrong, it was the school funding bill.
Correct.
But it's not, when it drifted to the other chamber is when it became this monster bill.
Correct.
Am I correct in that?
They've joined it with a number of other bills. SB 27 sticks out as the big teacher bill of rights bill.
Sure.
123, House Bill 123, which is an early literacy program. There's 5 or 6 other bills that were crammed at 260 that we discussed earlier. There's several bills crammed into this.
And correct me if I'm wrong, but more than likely than not, they were combined due to timing and things, correct?
Yes, sir.
In order to get them through.
Yes, sir.
Okay.
It's a lot easier to push one big omnibus bill than 6 individual, potentially controversial bills.
Okay, thank you.
So I won't go through all these again, but the last thing on here is you'll be required as a board to meet once a year to discuss performance of special education students. Lots of stuff in here on testing and teacher bill of rights, like Jacob said. Okay, so our key takeaways. We're not recommending any changes to our health insurance, so no increase to our employees. And we still need more analysis on this House Bill 2 before we can present an overall compensation plan, which we'll do next week. It's still, like I said, a lot to unpack. We saw all these pieces, but now it's a matter of going through and making sure those pieces are presented in the bill the same way we expected them to be. We spent a lot of time last week getting flyers that said, this is what's in the bill. And that's very nerve-wracking without actually reading the language of the bill. So, so far, not, massive surprises, just a lot of details and a lot to get through, so.
And then, Mr. Byer, if I may just, and one thing that I think you all need to know is HB4, which was the accountability bill, died. It did not make it out. We still have STAR. So the Senate and the House, weigh in where you want, Mr. Bywaters, but they were so far apart and they just simply could not close the cavern in time.
That's correct. There was an impasse on how exactly to reform STAR. The Senate had an opinion and the House had a different opinion, and they ran out of time on this piece. They sent it to conference committee in the last hour-ish, and it was just too much for them to get through.
Thank you, Ms. Lackhorn, and Mr. Bywaters for being here. Ms. Cox, you had some questions.
I just had one question about the removal of student piece. If you could speak, if you know much about what that's going to look like, if that's a documentation process or how that works.
There's quite a bit. I got that section today.
Yeah. So we're going to be working with Mr. Lopez. And so just so you know, when new laws are passed, TASB gets it, They will push out policy. They will give us some things. That's not going to come for a while. So what we're doing is Mr. Shoesmith reads through these things that impact that. We'll run it through Mr. Lopez, but ultimately we'll still wait for TASB to push out their guidance as to what it means.
And typically, those aren't going to take effect until September 1st anyway.
Yes, sir.
Not that that gives us a ton of time to digest things, but
It is not unusual for things to go into effect, at least on the finance side. So know that I'm only speaking about finance. And in 2019, when House Bill 3 passed, it was a big funding bill just like this one. And there were new allotments created. We didn't get rules for those allotments until April, but they expected us to be compliant with those rules, even though we didn't know what those rules were. So it takes time for all of this to digest and make its way all the way through the system. And so an interpretation today can be very different once the commissioner and all the lawyers in the state of Texas get through
But-
processing.
And Mr. Bywaters, correct me if I'm wrong, you're the expert here. You've heard rumblings that there could be a special called session.
It would be, if I were to put money on it, I would think it's unlikely, but it certainly is always a possibility. It seems like the leadership of both chambers and the governor are satisfied with their priorities at this point. But I mean, there are a number of bills surrounding bail reform that didn't quite get across. HB4 was a sticking point for a number of the more education-minded legislators. So it's always a possibility, but at this point, I would venture a guess and say it probably will not happen. But you can never guess, or we can never say with 100% certainty with the legislature.
do you have any questions from any trustees on what you've seen this evening? And we'll be looking forward to compensation next week.
Me too.
I do know, I just want to make sure we follow up regarding the tax question that Ms. Landry had, which I didn't jump in fast enough. I'm a little bit slower this evening, but I think they got rid of that, so the district still, I think, maybe still has to provide the 1095, but there is no requirement for healthcare coverage, so you will not get, I don't think you get a tax, I don't think you get penalty, thank you.
Right.
Penalty is what I was looking for, so, but please verify that for us.
Yep.
Absolutely.
What I'll do is I'll have Mr. Villarreal work with his folks and we'll get you something. We'll send you an email. Okay?
All right. Barring any questions, item 6, adjournment, and the time is 7:10 PM. Thank you all.